Good evening, everyone. This is Mamta Sharma from iChart Support Foundation, and we are glad to bring to you the seventh episode of True Talks for Therapists, an exclusive live series for mental health professionals. To answer our questions, we have with us Nitin Shah, founder and director of iCharts and iChart Support Foundation. Welcome, Nitin, to the seventh episode.
Thank you, Mamta. How are you?
I am good. Before we begin, I would like to remind everyone who's tuned in to like, comment, share this episode, and you can also start a watch party on your profile so that another other practitioners and mental health professionals can also benefit from our discussion today. If you have any questions from our earlier episodes that we may not have answered or you need further clarifications, please share them in the comments and we'll answer them towards the end of the episode or along the way. So Nitin, yesterday we spoke about cognitive therapy in great detail, and I wanted to ask you, what about CBT and REBT? They seem to be the more popular therapies. So, and how are they related to cognitive therapy, or how are they different from cognitive approach?
Okay. So, CBT, as the name suggests, is cognitive behavior therapy, which is a
Mm-hmm.
combination of cognitive and behavioral therapy,
Yes.
right? So, it involves both thought restructuring and
Mm-hmm.
certain behavioral interventions. For
Mm-hmm.
example, when we
Mm-hmm.
talk of identification of distorted thoughts,
Mm-hmm.
the clients may be given certain behavioral experiments where they will
Mm-hmm.
face the trigger and notice what their automatic thoughts are,
Hmm.
right? So this would be one example where you're not just working with thought restructuring, but you're also giving them certain behavioral experiments to be able to become aware and notice what's happening in their life.
Mm-hmm.
The client may be asked to maintain a thought diary. They will, which will probably help them in self-discovery. So it's basically a combination of cognitive work and behavioral work together. There are more examples that I'm going to give, but that's the basic idea. Then, when it
Mm-hmm.
comes to disputation, for example,
Hmm.
there are techniques like reality testing. Now,
Hmm.
in reality testing, what happens is that the client is actually asked to test their thoughts in real life scenario.
Okay.
Okay, so
Hmm.
for example, if a client
Hmm.
says that people will laugh at me when I'm on stage,
Hmm.
right? So remember we spoke about restructuring thought yesterday. That what will be the alternate thought that you would like to have?
Yes, yes, a functional thought.
A functional thought. Now, before the therapist questions the thought and makes the client realize that the thoughts may not be based in objective reality, a
Mm-hmm.
good idea would be to actually ask the client to test
Hmm.
this thought in their real life, right?
Mm-hmm.
Where they actually
Okay.
go to their friends and in front of their friends, they try and talk to them about the topic that they are going to speak on the stage. And because it's
Okay.
a selected group of people who are known to him, the chances are that the friends may actually like what he's saying and may not laugh at him,
Okay. All right.
right? Now,
Mm-hmm.
when the client realizes that friends have not laughed at him or her,
Mm-hmm. Hmm.
then they realize that obviously their original thought was distorted. It's not that people will necessarily laugh at him.
Mm-hmm.
Uh, that's where the awareness that their thoughts are not objective
Hmm.
can be brought in through behavioral experiment through reality testing,
Okay.
and then we can work with thought restriction again, because now the client not only knows it intellectually that their thoughts may not be based on objectivity, but they've had a
Mm-hmm.
real life experience that people have not laughed at him, and he realizes that, well, yeah, my thoughts were a bit distorted earlier. And once that
Okay.
realization comes in, the total thought restructuring should be good enough,
Okay. All
right?
right.
So
That makes
reality
sense.
testing would be one of the processes.
Mm-hmm.
Then, as far as safety is concerned, there is another process called validity testing.
Okay.
Now, in validity, the client actually it's more of a cognitive therapy process, but because CBT includes the cognitive therapy, so it will
Hmm.
also be a part of that. That
Hmm.
the client would literally be asked to defend their thoughts and their beliefs,
Okay.
right?
Okay.
And when they are defending, they are asked to focus on objective evidence, which supports their thoughts and their beliefs and their assumptions.
Okay.
Now, if there are no objective evidence to support their thoughts and beliefs, then they obviously recognize the fact that the objective evidence is missing. which means that there is a chance for that their thoughts, their assumptions, their beliefs are distorted.
Okay. Nitin, can you explain this with an example, please?
So, okay. So let's say a client comes to me and tells me
Hmm.
that my partner doesn't love me. He never
Okay.
listens to me. It's all about him,
Okay. Yeah.
right? Now they're asked to
Hmm.
give the reason.
Yeah.
Now, when they're giving their reasons,
Hmm.
uh, the therapist may ask them that, all right, can you give me observable reasons why you feel that?
Mm-hmm.
You will notice that a lot of times clients again start talking in generalizations and they were like, I know he doesn't love me because, as I mentioned earlier, he never listens to me, or it's all about him. He
Hmm.
he doesn't ever do anything for me.
Hmm.
The moment the client starts using all of these generalizations,
Hmm.
therapists may, from a purely cognitive approach basis, ask the client to tell them about things that happen in their day-to-day life, and in that,
Hmm.
pick up those incidences where the partner has done something for the client or has
Hmm.
listened to the maybe for a very small thing, but still listen to the client. So that's when the client
Hmm.
starts realizing they're kind of generalizing their ideas about their partner.
Ah, I get it.
Right now, in
Okay.
I was working with a client where once the client came and said this to me, but that my husband always misunderstands me.
Hmm.
So I asked her, can you give me examples of this? And she started giving me
Hmm.
examples, and she could give me like a list of examples. So when she gave
Okay.
those examples, the common thread between all of those examples was
Hmm.
that she was starting to talk to her partner about a problem that she was facing in the day.
Okay.
And the partner's response to her was that you keep complaining. I don't want to talk to you.
Okay.
So I asked her, so you are starting with a problem that you're facing. Your partner is saying that you are complaining and you are saying that your partner misunderstands you. Where is the misunderstanding?
Hmm.
She says, no, no, I am not complaining. I am just sharing.
Okay.
I said, fair enough. So if you're sharing, can you give me an example of something that you shared with your partner which started with a positive sentence in the last 6 months
Yes.
and
Hmm.
where your partner misunderstood you?
Mm-hmm.
She looked at me and she thought and she said, "Kuch, there would be something." And I said, all right, so think and let me know. After 10 minutes, she says,
Hmm.
I'm not able to recall anything. I think I'll need some time. So I said, we have time. You can sit and think some more time. After
Hmm.
another 10 minutes, he told me that, Nitin, I can't remember anything where I've said something positive to him in the last 6 months. That my conversation started with something positive,
Okay.
right? So, and then she carried forward and she said, but Nitin, I know even if I were to start with something positive, he would misunderstand me.
Mm-hmm.
So now this is where I brought in the behavioral experiment, where I actually told her that, all right, let's do one thing.
Hmm.
Um, why not go to your house today and start
Hmm.
by telling your partner how you have had a good day,
Okay.
and just say that. And let me know if your partner says something which makes you feel that the partner misunderstood. She went, she
Hmm.
did it, she gave me a call the next day and she said, my partner listened to me and he did not say that you're complaining.
Hmm.
Now, what did this behavioral experiment do? This is basically a combination of validity testing and reality testing, right? Because with
Hmm.
validity, I asked her to kind of defend her thoughts and beliefs,
Defend herself. Yeah. Yeah.
defend herself. And when she defended herself, and I realized that she's talking about something where
Hmm.
even if I say something to her, unless she's
Hmm.
experienced it in her real life, she would question
Hmm.
me. So I brought
Correct.
in the behavioral test where I told her that go and do this experiment with your partner and let's see what
Hmm.
happens.
Hmm. Correct.
Right? So both things can
Hmm.
happen that when you're doing validity testing, there is a
Hmm.
possibility that you will reach a place where you'll realize that beyond this, I probably need to do a behavioral experiment, and you will
Mm-hmm.
transition from validity testing into reality testing. Or you may
Hmm.
also realize that while you're doing validity testing, you're able to bring the client's awareness to something that contradicts the client's current assumptions and current arguments with which they're defending themselves. You brought it
Mm-hmm.
to the client's awareness, and the client realizes that they were probably exaggerating or generalizing in terms of what they were seeing.
Right. Right. That makes sense. That makes
Right?
sense.
Now,
Hmm.
before I
So.
go to the next technique in CBT,
Hmm.
I really wanted to check if you have any questions, if any of those people who are watching the video have any questions, so please let us know.
Right. There is how and when to introduce distortions to the client. Jagriti's question.
Okay. So Jagriti, so there are two ways in which you can introduce distortions to the client. One is by literally telling the client that they're distorting, which can become a bit confrontational, right? And I would probably avoid that. But I have seen therapists doing it. Some are able to do it effectively and successfully. Some end up creating more problems than what they're trying to resolve, right? So, I personally speaking would avoid directly telling the client that they are distorting something. What I would do is I would simply ask questions to the client, and when I'm asking those questions, through those questions, the distortions emerge. So, for example, and that's the reason I say that I would probably use the NLP meta model for it because it's more structured to help people understand where their distortions are coming from. So, I'm just giving an example in terms of the meta model distortions. There are places where clients will interpret. So, they would come and tell you that my partner doesn't care for me. Now, this is still an interpretation, right? This is not a statement based on facts. They're not telling you the
Right,
sequence of
right.
events that are making them
Correct,
feel rejected.
correct.
They are basically saying that my partner did something and I'm interpreting it as my partner doesn't care for me. So I would ask the client, all right, can you give me the exact set of things that your partner has done which made you feel that he doesn't care for you?
Okay.
Now, when I say this, the client would then tell me, oh, I went into the room, he did not even look at me, he did not even smile at me. Right? I mean, there would have been something observable that's happened that they've
Right.
noticed and they've interpreted it as my partner doesn't care for me.
Correct.
And that's the place where I would then ask the client that has it ever happened with you where you were sitting and doing something, someone walked into the room and you did not smile at them and you did not talk to
Yes,
them.
yes, yes. Yeah, yeah, yeah.
And invariably, the client ends up saying, "Yeah, it happens sometimes." And I'll ask the client, "So every time does this happen? It means that you're trying to reject the other person or that you don't care for this person that you're doing it with." And then the client is all of a sudden, "Well, no, there are times when I'm busy." So then the question is, all right, so can that also be possible with your partner? Now, I'm not saying that your partner is not rejecting you right now, right? I'm simply bringing it to the client's awareness that there is a sequence of events that happened that they've interpreted in a particular way, and there could have been interpretations in other ways also.
Correct.
Okay? And this the client agrees because the client herself has said that no, every time I don't look at a person doesn't mean that I'm not either I'm rejecting them or that I don't care for them. I may just be busy with what I'm doing. Now, with this, I've been able to create a doubt in her own arguments,
Correct.
right? And that becomes the starting point for us. And then eventually, after that, I'll take it forward depending upon what the client's response would be. So, this is the way I would work with distortions.
Perfect. Perfect. And Nitin, while the thought has been disputed, it does not seem confrontational at all. It's like a normal conversation uh, that you may have with anyone.
Correct.
So I think that works. That really works. Jaswinder is asking, can you explain meta model because you have been referring to it?
So, meta model is basically a set of questions um, from NLP, which are basically very structured, where based on what statement the client speaks, it gives you an understanding of what question you can ask them. It's very similar to the cognitive model, the cognitive therapy model, where you ask certain questions to clients to be able to clear up their unhelpful thinking styles. But meta model, in my understanding, is a lot more structured, especially when you're practicing it as a therapist to apply it in your sessions. If you would just do a cursory Google search, you will get answers for meta model. If you're looking for more details, I think on the iChar's website there would be an article on meta model which you can refer to.
Perfect.
Right?
Perfect.
Or if
Uh,
required, and probably when, because I've already committed that we will probably do an additional episode later on towards the end on unhelpful thinking styles and also the REBT, irrational
Irrational
beliefs.
beliefs.
Correct. So in that episode, probably I'll also talk about meta model because then it kind of fits in completely over there. I hope
Perfect.
that's okay.
Yes. Jaswinder, let's know if that's okay. Okay. I think Nitin, a lot of people ask us every day, how are we both? So if you can just reply to that, like
I
in
was just
one
actually
common
checking that.
statement.
Yeah.
Yes.
I was just checking that. So hi everyone. I'm really sorry. We kind of jump into the entire model very quickly, but that's because we know that we have like 1 hour to complete a lot of things. and then apart from that, it otherwise becomes too late. So I know that we have not been acknowledging highs and hellos, which we should be doing, but it's just that the time becomes a bit of a question mark. I hope you guys
Right.
understand.
Yes, I'm sure they do. Okay. Yes, Nitin, you were sharing about techniques. So we now understand reality testing and validity testing. What else is there in
Okay.
CBT?
So then one of the other things that is behavioral intervention would be journal writing, diary writing or journal writing.
Okay.
There, the client will be asked to maintain a diary of the situations in their life. This would
Hmm.
include every emotion, thought that they are having, the beliefs that they are becoming aware of. Uh,
Hmm.
so the idea is that when the client is journaling all of these things, they're obviously becoming mindful and aware of what's
Hmm.
happening in their mind and what's happening around them.
Okay.
Right? So it helps the client identify their thoughts, their emotions, and when they do behavioral experiments in combination with the
Mm-hmm.
journal, the
Hmm.
behavioral experiment results are also documented in the journal, which means
Okay.
the evidence in favor of the new thought and
Mm-hmm.
against the original thought keeps
Hmm.
accumulating. And as a result of that, eventually it becomes a lot more easier for the client to manage that thought.
Okay. Interesting.
Right? Journaling is a very useful process. It's used not only with CBT. I think there are other fields of therapy which also use it, but journaling is generally considered to be very useful from a client perspective.
Okay. All
Then
right.
next is guided discovery.
Mm-hmm.
Now, in guided discovery, you're basically going through a series of question and answers. It's like a discussion that you're having with the client. You know how at times you're having conversations with people around us, and in those conversations, some really insightful things come up,
Yes.
where we start recognizing how there were certain things that we were thinking in a particular way which may not have been right. There are certain distortions that we have been using.
Right.
There are certain things that we have been perceiving in a particular way which could be perceived differently.
Hmm.
So guided
Yes.
discovery is something like that, where the therapist and the client are asking question and answers, and through those question and answers, it's like a discussion that's happening where new things emerge.
Correct. Okay.
Right? So
Hmm.
basically, along with the cognitive therapy techniques that were there that we
Hmm.
discussed yesterday, there
Hmm.
are a lot of homeworks that is used in CBT. There are behavioral experiments that
Hmm.
are a part of these homeworks at times. The client may even have to write diaries.
Hmm.
Um, and then there are places where clients will be asked to go through the notes of the session. The client may be even asked to go through a online course or read a book which helps them become more aware of how their mind works. So there's a
Mm-hmm.
lot of psychoeducation that also gets involved through behavioral experiments,
Okay. Makes sense.
right? And
Hmm.
like I said, that CBT would include some of the cognitive therapy techniques that we discussed earlier. Since it
Mm-hmm.
also obviously includes behavioral therapy, the techniques that we discussed on, I think, day before yesterday from behavioral
Hmm.
therapies, some of them would
Hmm.
also get incorporated with CBT.
Okay. All right.
I hope this clarifies things for you and for
Yes.
people who are watching it with respect to CBT. If you have any questions, people, please let us know. Please ask us so that
Uh,
we can.
there are questions, but I thought let me just let you finish the techniques bit, and then we can probably take them up together.
All right. So then probably there's one. Yeah, so I think I'm done with the techniques related to cognitive therapy and CBT. So if you
Okay.
have any
Okay.
questions, or if there are any questions, then let me know so I can.
Yes. Jaswinder is asking, what are your names, please?
Okay. So Jashwinder, my name is Nitin Shah, and Mamta is with us.
Yes, I think I've also replied to her in text. Ranjit is asking, is reality checking and reality testing the same?
Ranjit, you'll have to tell me what do you mean by reality checking. But in most cases with behavioral therapy, CBT, what you're looking at is reality testing, where you're testing whether what the client is saying is factually true or not. And in most cases, it may not be, and that's the reason you'll be able to restructure the thought. So as far as the names are concerned, I'm assuming they would be the same thing. Unless you have a different meaning associated to it, then you can clarify, and then I can probably take that up.
Okay. Bhavya is asking, everyday journaling would require motivation, right? How do we get that going for them?
Mamta, you would like to answer that? I'm sure you would know by now what my answer would be.
Okay, so you can work with the related thought that triggers whatever the lack of motivation, emotion, or feeling is, which you can work with. So that's we've spoken about thought restructuring or cognitive restructuring already, and we can associate it with the trigger that every time they think of journal, or every time they pick up the journal, depending on when exactly do they need that motivation. So, right.
Correct. So that would be one way of doing it, which will be when then. What I
When
would
then,
do is,
yes.
so what I actually do with journaling and all of these things is, I tell people that fix up a time during a day where they would want to journal. Because
Right.
many a times I've had people who have told me that Nitin, hum bhool jate hain. We forget that we have to write a journal.
Yeah.
And obviously, if you forget writing, then there is nothing else that you can do. You will need to remember it. So the
Hmm.
idea behind that is, I would, so to deal with that, what I would do is I'll actually get into a behavioral strategy where I'll ask the client, tell me at what time during the day would you like to journal.
Hmm.
When they tell me the time, I'll ask them to actually put an alarm in front of me so that that alarm is there on
Yes.
their phone. And then I'll connect that alarm with the when then statement and for thought restructuring. So the statement then becomes, when I hear the alarm, then I realize writing a journal would help me do this. So that
Perfect.
can probably help them with motivation. And last case scenario, if none of this works, then I'll probably just guide them in a hypnotic state, create a condition between motivation and writing a journal entry where when they write journal entry, they enjoy. So if they start enjoying writing a journal entry, then probably they would be able to do it more effectively. I hope,
Correct.
Bhavya, that answers your question.
Question. Right. Okay. All right. So, Nitin, my favorite question: how would you use hypnosis with CBT now?
All right. So we've actually already spoken about this. We have spoken about how we can use hypnosis with cognitive therapy in the beginning, as in
Hmm.
yesterday when we were talking about it. We also spoke
Right.
about how hypnosis can be used with behavioral therapy in the episode before that, right?
Right.
So
Correct. Correct.
because CBT predominantly includes techniques from both those areas, we have
Hmm.
more or less already discussed how we would apply
Yeah.
hypnosis with CBT as well.
Right.
And like right
Right.
now, I gave the example of journaling, that
Motivation. Yeah. Correct.
motivation. So in a way, what I've actually done is I've combined all three together, right? With
Perfect.
for journaling, I've first brought in a behavioral strategy where I've
Hmm.
told them to put an alarm. Then I've
Hmm.
done thought restructuring through when then, which ideally would be a cognitive approach. And I've
Hmm.
also done an association between enjoyment and doing a diary entry, which will be done by creating a association. And for this, I will especially probably use a process to induce a client in a hypnotic state.
Perfect. Perfect. I think that's pretty clear. If anyone has any questions, you can ask us now about CBT or cognitive approach so that we can address them. And since there are no questions so far, we'll take them up as they come, Nitin. So now moving on to REBT. What is that? And what is the difference between REBT, CBT?
Okay. So the difference between REBT and CBT is that CBT generally works with distorted cognitions, right? Which means the thoughts that people are having, which may be automatic or which may be something that they're consciously aware of. REBT, on the other hand, focuses more on the underlying beliefs that are resulting in the distorted thought. Uh,
Okay.
Once the client is able to identify what their distorted thoughts are, there will be a
Hmm.
process of questioning with which the therapist would be able to help the client dig deeper into what are the underlying beliefs from where these distorted thoughts are coming.
Hmm.
And once they identify the deeper beliefs, then with these deeper beliefs, they will start restructuring these beliefs and start working with these beliefs so as to create the desired outcome.
Okay. So, Nitin, would it be fair to say that they're both working at different layers of the problem, if I recall the first episode correctly?
Correct. So from the way we have discussed about layers in the first
Yes.
episode,
Hmm.
cognitive therapy or CBT both are working more with the real time thoughts that people have, right, which
Correct.
are interfering in their actions.
Correct.
Um, REBT on the other hand would dig deeper to
Hmm.
identifying what the underlying belief is, so that they can
Hmm.
work with the underlying belief.
Okay. And Nitin, in terms of, so can you give us an example to elucidate the difference between CBT and REBT, or working with a client using CBT and using REBT?
Uh, okay. So let's say I have to go for a date,
Okay.
right? I went for this date with this particular girl, and things turned out the way they turned out.
Hmm.
Um, After some time, after a couple of days, I wanted to ask her out for another date,
Hmm.
right? But then I had this thought in my head that said that, when we went for the first date, she wasn't so interactive.
Okay.
Um, she was very quiet. She
Hmm.
did not really open up too much about herself, and
Hmm.
that's maybe because she's not interested in me. So if she's not interested
Hmm.
in me, what is the point of asking her out again?
Okay.
Now, would it be fair to say that this thought that she's not interested in me is
Hmm.
what is stopping me from asking her out again?
Yeah.
Yeah. But
Yeah.
her not talking to me about her personal life and her not
Hmm.
being interested in me are not
Hmm.
necessarily always equal, right?
Hmm. Hmm. Yes, absolutely.
As I mentioned earlier, this could simply be my interpretation and may not be based in objective reality,
Hmm. True. True. True.
right? So, in which case, the CBT practitioners or CBT as a field would look at these interpretations as distortions and
Hmm.
would try to work with these distortions by restructuring them,
The thought itself.
the
She
thought
isn't
itself.
interested in me.
Correct.
Huh.
So
Okay.
probably, the new thought would be that I would only know whether she's interested in me or not when I ask her out.
Hmm.
Right? Maybe there were some other reasons why she was not able to open up. So basically,
Correct.
you will restructure the thoughts to ensure that the client feels more comfortable going on with whatever behavior they wanted to do.
Hmm.
Right?
Correct.
In RABT, on the other hand, when the client says that she is not interested in me, uh, the practitioner may ask more questions to be able to help the client dig deeper.
Hmm.
And eventually, the client may actually end up saying that, yeah, she may not be interested in me because I'm not good enough.
Right.
Now, what the client is talking about is a more deeper underlying belief.
Hmm.
When you work with this statement, I am not good enough, this statement or this belief would actually be interfering with multiple areas of the client's life, not just the dating aspect.
Yes. Correct.
Yes.
Correct.
So with CBT, when you work with the thought, you're working with a more specific issue, and probably that issue will get resolved, but other related issues may not get resolved.
Hmm.
With
True.
REBT, because you're working with a layer which is deeper, obviously
Mm-hmm.
that belief may influence multiple areas of the client's life. And once you
Hmm.
work with that belief,
Hmm.
the results may be experienced in like a broader spectrum of the client's life. And to that extent,
Mm-hmm.
in my understanding, REBT will be more comprehensive.
Okay.
Right? Now,
Okay.
while I'm saying this, the
Hmm.
challenge with REBT is that beliefs are generally more unconscious than thoughts are.
Yes.
Right? So at
True.
times, to actually be able to identify a deeper core belief
Hmm.
may take a long time. Well, even if you think you've come to a core belief, after some time you may realize that there is another belief which is deeper than this,
Mm-hmm.
because kind of beliefs also interact with each other, right?
Hmm.
And while we are attempting to kind of identify the core beliefs consciously through conscious
Hmm.
questioning, we may
Hmm.
need to confront the client.
Hmm.
And as I mentioned earlier, at times these confrontations can create more problems than resolution. So if you have the
Hmm.
chance to be able to work with the client consistently and the client continues coming to you for sessions, then you would
Hmm.
be able to get good results, even if you're using like aggressive confrontation if required. But
Hmm.
if the client decides to discontinue the session in between because they were
Hmm.
not happy with the approach, the chances are that they would be more convinced about their belief, and their experience with the therapist may mean that they may not even want to visit another therapist,
Oh. Okay.
right?
All right.
So,
Hmm.
I would be a bit careful about using confrontation. So as an approach, REBT is brilliant. But as I said, you have to be slightly careful. It should not become too confrontational.
Hmm.
And it may take longer for you to actually be able to identify a deeper core issue, especially
Hmm.
if the core beliefs are more layered.
Okay.
Right? So what I
Mm-hmm.
would really do is I would take the principles of REBT because I understand
Hmm.
the importance of working with beliefs, right?
Hmm.
Uh,
Hmm.
and then I would probably I would induce them into a more receptive state first. Then I would use
Hmm.
certain other processes which will help the client observe the experiences from a more objective point of view, so that they are able to
Hmm.
identify and understand their beliefs more. What should I say? Uh, they are able to recognize their beliefs rather than me having to confront them,
Okay.
right? And once
Mm-hmm.
that happens, then there are interventions that you can use to help them change their beliefs.
Okay.
And lastly, there are also places where beliefs, when you are working with beliefs, like we mentioned, different layers and problems, right? There are places where, in order to work with beliefs, you will have to dig deeper into past experiences so that the client can notice those experiences and realize that those experiences are over and where those beliefs are coming from. So
Mm-hmm.
then again, if those memories are repressed or something, being able to guide the client into that state where their unconscious is also receptive can be extremely, extremely useful.
All right. All right. So irrational beliefs and how to work with them, and then what
Correct.
is there
So
something else?
that's so that's one aspect of REBT which is really good, which it focuses not just on ongoing thoughts but also on
Hmm.
deeper beliefs.
Hmm.
Uh, Apart from that, there is a very interesting thing in REBT which I think can be incorporated in any other form of therapy, which is the
Mm-hmm.
idea of unconditional acceptance. Uh,
Okay.
this basically involves the client to be able to unconditionally accept themselves with all their flaws, accept other
Okay.
people with all their imperfections, and also
Mm-hmm.
accept life unconditionally, knowing that life will have its discomfort, will have its hassles, will have its challenges, and that there are times when the life will be unfair.
Right.
Right? Now, this is interesting and useful when people are actually able to do it. Obviously, but
Hmm.
knowing that you need to do it and being able to do it are two different things altogether.
Hmm. It's almost like an ideal scenario.
Correct. And that's where it can become a bit of a problem. I think in one of the earlier episodes, someone had also asked us this, that what if people are willing to accept intellectually, but they're not able to kind of imbibe that acceptance in their system? Then what do we do?
Mm-hmm. Hmm.
Right? And that's the reason why when I had shared the example of flip and hypnosis, I had mentioned that the way I would work with this is
Hmm.
probably the realization that the client needs to accept themselves needs to be more conscious. They need to agree with that consciousness.
Hmm.
But after that, how do I imbibe it in their being? So, as to
Hmm.
say, we'll come through an altered process where we are able to help them get into a receptive state, give suggestions to the unconscious, be able to work with the unconscious in the sense in which the client doesn't have to put an effort to accept themselves. They start noticing the benefits of that acceptance playing out in their life.
Mm-hmm. Okay. Right.
Right?
Makes
So
sense.
that's
Yes.
how probably I would work with the acceptance with. But yes, the concept of acceptance I think is really, really interesting. Well, for example, when you're talking about CBT, right? So when people are working with self-esteem, many a times a lot of counselors would make the client realize that they are good at certain things. And that's the
Hmm.
way they try to compensate for low self-esteem. Where while the client feels that I'm not good enough, the therapist would show to them that there are things that they are good at, and via that they would try to boost their self-confidence and self-esteem. Now, the challenge with that is that if someday in future the client fails to do what they were good at doing earlier,
Hmm.
or you're looking at a massive relapse, right? With REBT, because you're beginning by asking the client to acknowledge that all right, there are flaws and it's okay, everyone has flaws,
Mm-hmm.
right?
Okay.
So
All right.
that future implication will not come in because even if in future they make a mistake, they realize that's okay. They everyone has a flaw, and so do they have, and they are able to accept it. But again, knowing that I need to accept it and being able to accept it are two different things altogether, and that's where we have to be careful whether the client is just intellectually accepting it or is really imbibing it,
Correct. Makes sense. Makes sense.
right? Um, yeah, so there's belief, there's unconditional acceptance. Um,
Hmm.
what else? So REBT also would recognize secondary disturbances.
Okay. Which means.
Uh, have you come across a situation where a client tells you that I'm anxious about feeling anxious?
Hmm. Hmm. In fact, there is an interesting saying about these. My anxieties have anxieties.
My anxieties have anxiety. So those are secondary
Yeah.
disturbances where uh,
Okay.
I have a problem and then I'm worried about the fact that I have a problem.
Okay. Or maybe the problem is ongoing and I keep worrying about when is it going to surface. It's something like that?
Correct. So it's both. That one, I'm worried about the anxiety in this
Hmm.
case, and I'm also
Hmm.
worried about what if it happens and what all wrong can happen as a result of that.
Hmm.
So interestingly, I actually had a client once. So this was funny.
Hmm.
Funny. Now that I'm sharing it in retrospective, it was funny. But so the client came with an anxiety issue. Had been
Hmm.
going for well, had been on medications for years. The
Hmm.
psychiatrist referred the client to me, saying that we have tried and we are now worried that well, we have to increase the dosage of medication to an extent where I'm not sure whether I should do it. So can we do
Hmm.
something through an eclectic approach to work with the client? So I
Hmm.
started working with the client. The client, after I think 2 or 3 sessions, 2 sessions. In the third session, when the client came to me, the client sat in front of me and he told me, Nitin, I'm still anxious. And I said, about? And he said, I'm anxious that why am I not feeling anxious during the day as frequently as I used to feel earlier?
Hmm.
Right? So it can also at
Yes.
times happen that way. Then you will also come
Yes.
across
I
people who
agree.
are at times angry about feeling guilty or guilty about feeling angry. So I, for example, had a
Hmm.
situation where someone once told me that, Nitin, I feel so guilty that I get angry
Hmm.
at my partner.
Correct.
So these are all secondary disturbances. So the idea is that when you're working with the client, work with both. Work with the primary and the secondary. And many a times the client will come and tell you about the secondary disturbance because that's what is in their immediate uh, understanding. So it's
Or
important for you
that's
to be
their
able to
urgent,
ask.
that's like a more pressing problem.
Correct. So that's more pressing problem. So there, it's at times a good idea for you to ask the client, question the client, so that you can bring them to a primary problem also and work with both the secondary and the primary disturbance.
Perfect. That makes sense. Nitin, we have a lot of questions. Can we pause here, or is there some you want to finish saying something?
So there's I so what all have I covered? I've covered beliefs. I've spoken about acceptance.
Unconditional acceptance and secondary disturbances.
Perfect. So there are a couple of more things about REBT, but I'll probably take that up after the question. So let's do the questions right now.
Okay, a couple of questions. So, how can you help a client who has repetitive negative thoughts? Amit is asking this.
Okay. How do you help a client who has repetitive negative thoughts? So
Yes.
Amit, I work in a way in which so I will combine a couple of things. So one, I would actually first identify what the triggers are, where they get repetitive negative thoughts. That will be the
Hmm.
first thing.
Hmm.
And then I would see if I can use Venn to just restructure the thoughts, if that's possible. Though
Hmm.
in some cases that may be difficult.
Hmm.
Second, I at times use a hypnotic process where I'll ask the client to have a conversation with the thoughts that they have to see if the conversation can be carried forward. Now, one of the things that I've noticed is at times, have you ever had a situation where a song got stuck in your head?
Hmm. Oh,
Now,
so
what
many
really
times.
so many times, right? So, one of
Hmm.
the best ways of ensuring that the song gets unstuck in your head is by
Hmm.
listening to the song completely. If you hear the complete song from beginning to end, many a
Hmm.
times that song will get unstuck from your head. So
Hmm.
what's really happening is when a song gets stuck in your head, the mind is trying to figure out what the next line was, and because it doesn't know what the next line is, it kind of
Hmm.
keeps thinking and going into patterns, trying to come up with the next line, which it's not able to because then we are also beginning to get anxious. We are also beginning to get kind of irritated. So that irritation, anxiety also prevents us from being able to tap into our internal resources to check what the next line would be.
Hmm.
Right? With negative thought patterns, at times this is what happens that the clients are stuck with a particular pattern. Their mind
Hmm.
is trying to figure out what next, but they are not really carrying on the conversation.
Hmm.
And in that, the mind has just got stuck in that loop. So there are places where I'll just ask the client to have a conversation and I'll ask, all right, so if this happens, what will happen next? And then what will happen
Hmm.
next? And what will happen
Hmm.
next? And eventually it reaches a place where the client realizes, yeah, it's not such a big deal. So that will be
Correct.
another way of dealing with the repetitive negative thoughts. You could
Hmm.
do it conversationally also, or you could also do it through an altered process where you induce them in a more relaxed state first, and then have a carry on a conversation like that, right?
Hmm.
Uh, in psychoanalysis, there's a concept of free association, right?
Hmm.
So I could also use that where I could ask the client to observe that repetitive negative thought that they have and then tell me what that reminds them of and see if there's a deeper issue that pops up as a part of the process.
Okay.
If it does, then I would probably also deal with the deeper issue. But will it
Hmm.
always prop up? The answer is not necessary. At times, just playing with the thoughts and carrying on a conversation is okay. Last,
Okay.
and this is something that happened with me recently with one of the clients,
Hmm.
and this was not something which was my intervention. It was actually something that client came and reported to me, which I think was
Okay.
quite useful even from the point of view of therapy that I take now. So the
Okay.
client had suicidal ideation, and she would have those thoughts, and she would be, malab, she had been again on medication for some month, and it had almost reached a
Hmm.
place where she told, malab, before she had come to me, she had told her
Hmm.
parents that I don't want to die, but the thoughts are so prominent that I may end up doing something because I want to get rid of these thoughts.
Hmm.
So when she came to me for the session,
Hmm.
and I started speaking to her, she told me that Nitin, rationally, logically, I know I don't want to die. But the
Hmm.
thought that I should do something to myself is so repetitive, one.
Hmm.
And second, when I have this thought, I get so anxious that I don't know what to do.
Hmm. Correct.
Correct?
Okay.
So
Okay.
now we did some process that we had to do. I had done a metaphor process with her and so on. So she went
Hmm.
back home. She, after 4 days or so, gave me a call and told me that she's feeling better, but still those thoughts are there that are worrying her and so on. And then after I think another 3 or 4 days when she came for a session, she was like very happy and chirpy. And so I asked her, "Good, what all changed?" So she told me, Nitin, I had a conversation with my brother, who was somewhere abroad, and she
Hmm.
said in that conversation, I told my brother that I have these thoughts that I should kill myself, and that's what worries me a lot. And my brother told me, big deal, I also have those thoughts. But I tell him, I said, that's okay, I know I'm not going to do it. And she said, just the realization that, all right, so I had a thought, big deal, I know I'm not going to act upon it.
Correct.
Right? Now, when she said this to me, I actually thought probably this would have been logically the first thing that I should have done with her, right? But somehow it just did not click to me when I started working with her initially. So,
Hmm. Hmm.
with repetitive negative thoughts at times, and that's where when we spoke about acceptance in
Hmm.
REB, that's where it comes
Hmm.
up that to say that I would never have a negative thought is probably pushing it too far. The problem is
Hmm.
not that I have negative thoughts or I have repetitive negative thoughts. A lot of us
Hmm.
have thoughts that are negative, and many times
Hmm.
they're repetitive. We are just not aware of it. Some people
Correct.
get hooked to those thoughts and they start feeling like very, very concerned about it.
Hmm.
Right? So these
Hmm.
are the layers that I would work with. I would work with either changing the thought association with the trigger. I would
Hmm.
also work with helping the client realize that once in a meanwhile, if they have this thought, it's okay, all of us have it. And be
Hmm.
able to imbibe it in their system that they know that whenever they have this thought, they have this natural tendency to realize that, yeah, it's one of those thoughts that will pass off. So I can probably bring in hypnosis over there if required. Right? And then if there
Correct.
are deeper issues, then I can also address those deeper issues. I hope that answers your
Perf-
question.
Perfect. Quite nicely, I think. Okay. Deepika is asking, does CBT work for children?
It should work for children. Uh, Obviously, working with children will be slightly different. You will not use the exact same process that you use with adults. With children, you want to do certain things which will also come across as games or which will also come across as activity based work. But I with people that I know of who work with children, I have been told that CBT works very well with children. As I said, again, you can do you need to use only CBT or can you incorporate other practices? That's completely a choice. I know of people who incorporate CBT and art based work with children, and they get really good results. Especially
Hmm.
when children are not able to open up, they're not able to talk, they will incorporate art based work. They will bring in
Hmm.
drawings, they will bring in drama, they will
Hmm.
do play work, play activities so that the child becomes more comfortable, starts metaphorically talking and
Hmm.
sharing about things that they need to share about. You
Hmm.
can again use processes from hypnosis and NLP like anchoring to be able to help the child feel more comfortable and also
Hmm.
eventually do thought restructuring and teach. I would personally, matlab, I don't work with kids as much, but when I work with kids, I love teaching kids when then statement and they love it because for them it becomes like a game that they are playing and it also is like a lifelong tool that they've learned.
Hmm.
So I
Correct.
would say that CBT would work with children. But you will also need to have separate skills to work with children. CBT is just an additional skill that you're incorporating.
Zeenat Pathan is saying play therapy.
Play therapy is a good process to work with kids.
All right. Nitin, Bhavya is asking, is it only through experience that we can effectively use different techniques for different issues? Or is there some kind of rubric which we can follow?
So, Bhavya, So it's actually a combination. One is it's your training, because it's in your training that you will understand how you can incorporate processes together. Uh, and that's where, while I understand that a lot of people do their masters and they also do their MPhils and so on, my personal experience with university courses is that while they are important because they give you a lot of conceptual clarity and theoretical background, but practical skill is very, very lacking in most of our curriculums, right?
Hmm.
And
Hmm.
even the practical techniques that are taught to us in terms of observation, where even if we are doing internships, we are not really allowed to work with the clients. We are just observing the clients and so on. And I understand why. I run an organization. I know we take interns, so I understand why in many organizations interns are not allowed to practice with clients, right? But then that doesn't really help us develop the necessary, what should I say, skills and the confidence to play with techniques and work with clients. Now
Correct.
that's where a lot of these certificate programs come into play, because most certificate programs, whether it's the programs that we conduct on cognitive hypnotic psychotherapy or even other programs like CBT, like REBT, there would be a lot of emphasis on practice sessions. So that's where you start learning and applying those processes, and you start really experimenting and checking what works, what doesn't work. Again, if you will
Right.
ask me, obviously, if I've created a course, I'm partially, matlab, I'm slightly biased towards that program. At the end of the day, I've created the course, and I personally feel that we've integrated a lot of things together. So I would recommend the course that we conduct, which is cognitive hypnotic psychotherapy, especially if you've completed your master's in psychology. Then that is the course that I highly recommend, because it integrates a lot of things together. But as I said, any good skill building program, especially if you've heard really nice things about the trainer, I would suggest go and attend that program. And attend the program for the trainers. The concepts are all
Yes.
available online. What the trainer brings in a training program is only something that a trainer can bring in. So
Correct.
I would suggest that when you're looking at developing skills, skill certificate programs are very useful. And do a program with a trainer that you've spoken to and you know, or you've heard, and you know that they know what they're talking about.
Absolutely. That does make a lot of sense. Perfect. Nisha is asking, with REBT, does guilt and shame arise and need cognitive restructuring?
So, Nisha, it depends upon how the REBT practitioner is applying it. Because, again, like I said about hypnosis, a lot of these therapies are not just about the therapy that you're using, it's the skill set of the practitioner. As I said with REBT, one of the primary principles is unconditional acceptance. If you're able to imbibe that unconditional acceptance into your life, then guilt and what should I say? Guilt should not arise, or shame should not arise. Not in the sense where it becomes dysfunctional, right? Uh, if it is, then probably the practitioner has not been able to apply, or has not been able to translate the intellectual understanding of acceptance that the client has into practical practice. But ideally,
Mm-hmm.
if it's done correctly, it should not happen.
Okay. All right.
Okay. Like I mentioned earlier, I would probably combine this with, matlab, I would do work with beliefs more from the point of view of flip and hypnosis, simply because that ensures that I don't have to confront the client, and also it ensures that the client has already explored what they could learn from it, how the learning will be applied in their life in future. So all of that ensures that the chances of guilt and shame is comparatively less.
Perfect.
And rest we can always work with suggestions.
I
I
hope
hope
Nisha that answers your question.
Great.
Yeah.
So I hope that answers
Uh,
Nisha's question and also Bhavya's question that we answered earlier.
right. Right after this, there is a question by Amit where he says, "And how we come to know about it." Amit, are you referring to Nisha's post? Are you talking about something else?
You will have to
It's
kind of just
difficult.
clarify so that we can
Yeah,
understand.
can you say that? So Deepika is saying, yes, I do art based work. Okay, great. Jagriti is asking, can you explain when then statement more concretely, please?
So Jagriti, what I can do is I can share a link to the article in the comments right now, and you can go through it. And if you still have questions tomorrow after that, then I can probably take up those questions in the beginning. Would that be okay?
I will wait for her to say
Okay.
yes.
So meanwhile, also let me just check the link so that I can share it with you.
Perfect.
So,
Uh,
any other questions that anyone has before we
yes,
go?
Amit is asking what will work best for children with conduct problem. Amit, are you referring to discipline, behavioral conduct? Please specify so that we can answer it. And Nitin,
Ananta, would
meanwhile,
you
you can.
like to take that question up so that I can just search for the link meanwhile?
Hmm. Okay. So as far as I understand, Amit, we have been referring to positive intention. So there were, I think, yesterday one we spoke about is the child learning it somewhere. For example, when we spoke about child using abusive language, is he or she observing a parent or somebody at home or school or in their neighborhood or vicinity? Then we need to work with that person and help them address their mental state. If that's not the case, then we need to work with the child in terms of, as Nitin has been telling us, about positive intention. So what is at work there? Is the child seeking help? Is the child seeking attention? So we need to fulfill that positive intention with a constructive behavior, with an alternate constructive behavior. Probably the child has no idea what else they can do, in place of throwing a tantrum or screaming or whatever it is that they are doing. uh, Nitin, would you like to add to that?
Yeah, so I would probably add that one, I would have a conversation with the child to understand what is the child's reason, and
Yes.
you will need to have like really develop a proper rapport with the child to be able to do that.
Yes.
If the
Yes,
child
of
feels you're in the
course.
parents team, the child, you have already lost the child. So you have to ensure that you and the child can actually see you in their team rather than the parents team, which is one. Second, I would probably also get into using art based therapy or drawings to be able to work with the child for disorder. And eventually in the well, once I understand this with children, I've always said that I would make it mandatory for parents to be a part of the therapy,
Part of the
where I
therapy, at
do
least
a
one
therapy
parent.
with the parents separately,
Correct,
right?
correct. And
and
the,
and that's where the difference would come in, the combination of me working with the parents and the child together, knowing that the child knows I'm in the child's team and the child can have that rapport with me to be able to share things, plus finally for me to be able to help the child overcome or gain the positive intention that they were getting through the conduct disorder. It will probably work with the child better. That would be the process that I would use.
Perfect. And Nitin, I think in case of children, when people are asking questions about children, the age group also matters a lot. So if the child is 13, 14 or older, then we can use a lot of, I think, if not most, a lot of processes and techniques and methods, because children these days are quite perceptive. Obviously, it depends on the individual case as well. So, but when they're younger, then we have to rely mostly on metaphors, art based, and play based work.
Correct. So the thing is, all right. So this is the way I look at it. There are So if the child is too small to be able to consciously, cognitively give you a lot of description, then art-based metaphors will be very effective. Stories will be very effective,
Yes.
right? When you are working with kids who are of an age group where, uh, there is this age where you know that you're not in control, but you want to be in control. You're dependent
Hmm.
on your parents, but
Hmm.
you want to get away with things that you want to do. Probably somewhere between around 8 to 4, 8 to 10, 11, right?
Yeah.
That's the place where I will use a combination of the art-based work and probably what we've spoken about with the when then statement. Uh, 11 to 14, I would probably focus more on establishing rapport with the child, because this is the age where children mostly feel that everyone is in the parents' team and they are left all alone and no one listens to them. So I
Absolutely.
would make it a point to be able to listen to the child and work with them. And then when they reach a stage where they can be self-dependent, then the work with them becomes different. But beyond 15, I can probably use most of the process that I'll use with adults. The
Yes.
only thing with
Yes.
kids where the problem is that kids are dependent on parents. So even if you work with it, but for example, even if I work with play therapy and even if I work with CBT, I'm only working with a child there, right? Eventually, the child goes back to the same house, meets the same abusive father or the mother who's constantly on the phone, or it gets exposed to the same conflict that are happening in the house regularly, or is being bullied by the same set of people. So if that's happening, unless you help them work with that environment, which sadly child which is small or who's small will by himself or herself not be able to handle that. So there, working with the environment becomes very important. But if you have a child who comes and tells you, for example, I had a child who had once told me that, Nitin, I am doing this intentionally because I want my parents to suffer. Right now, that is a place where I could sit with the child, talk to the child, understand what was happening, and help the child develop a better relationship with the parent. But again, I had to bring in the parents to some extent or the other. I hope
Perfect.
that
Perfect.
answers the question.
Yes. So Nisha is saying yes. Thank you. Bhavya is saying yes. Jagriti is saying yes. Amit is saying yes. Ranjit is asking which works better for OCD, REBT or CBT?
So the way I would work with it, initially I'll work with the thought restructuring so that I can at least work with the what should I say, symptomatic problem. But I would not leave it over there. I would go deeper into the belief and work with the belief.
Perfect.
So it will be a
Perfect.
combination, but I would start with CBT because directly going towards REB, matlab, towards beliefs for a
Hmm.
client who's already having an OCD may take some time.
Hmm.
Um, and this is if I'm not using hypnosis at all, matlab, not the hypnotic induction processes, so as to say. But apart from that, it will be a combination.
Ranjit has followed it up with another question, Nitin. My client with OCD, his recent obsession is he would become an introvert. I just helped him to identify his negative associations with introvert and made him justify his associations toward the end of the session. He accepted that his associations are subjective and he had overgeneralized. Is it REBT that I had done with him? Please clarify.
Well, that depends upon the underlying assumption that they were talking about. If the underlying assumption fall within the category of one of the irrational beliefs that REBT talks about, then REBT. If you have just worked with the symptomatic thought that they had, then CBT. Um, so that probably will be the distinguishing factor. Also, the client's acceptance that they have overgeneralized. I would not necessarily consider that to be the end of therapy when it comes to OCDs, because I know of people who have had OCDs who accepted, who recognized the fallacy in their thinking and the beliefs, and yet they were not able to control their impulses to continue with the compulsions. Right?
All
So
right.
there,
Right.
I would work with positive intention. In most cases, positive intention comes in.
Correct. Makes sense. Makes sense. Ranjit, I hope you got your answer. Sita Lakshmi is asking EI, I think emotional intelligence, behavioral, and stories could work. I think she's referring to children.
So it would work to an extent where you're able to bring in awareness for the child and create changes in the child. But because I said with children who are small, uh,
Hmm.
they are dependent on their environment. So you will have to do something or the other to work with that environment as well.
Okay. Sita
So
Lakshmi,
to that
let
extent,
us
then we
know.
are also incorporating like family therapy into the
Okay.
equation.
Okay. Prashanti is asking, does hypnosis work with special needs children?
So will hypnosis alone be enough? The answer is no. If you are someone who is trained to work with kids who have special needs, right? And
Hmm.
you learn hypnosis so that you can combine hypnosis with kids who have special needs. It will work. And I have people who I know of who combine the two together. But if you're talking about only using hypnosis without having the skill sets to work with special needs kids separately, then I wouldn't even suggest you should attempt it, because
Perfect.
that training is important.
Perfect. Amit, Prashanti, I hope you got your answer. Amit is saying, how will you identify that the client has actually understood whatever we have spoken about, or is it superficial?
So if it's superficial, then the client will say, I understand, but the client is not really able to change their emotional states associated to that. They would still say that I feel guilty or I feel uncomfortable. They would still say that I still have that discomfort, but I'm able to overpower it because of the thoughts, because I'm able to restructure my thought later on and I realize that my original beliefs are wrong. But if they have to still do it after 2 3 weeks, where they are consciously still requiring to restructure their beliefs, then there is a possibility that it's not yet been imbibed completely.
Okay. Amit, let's know if you have your answer. Okay, Ranjit is saying, yes, sir, it's pretty clear. I'm still working with the client, with him, with the client. Sita is saying absolutely. Neha is asking, on what basis should a professional decide which modality to use, REBT or CBT with a client?
So Neha, as I said, so I understand a lot of people promote themselves as CBT practitioners or REBT practitioners. I So personally speaking, I actually don't agree with that process that I'm a CBT practitioner or REBT practitioner or even a hypnotherapist for that matter. Because eventually when the client is coming to me, the client is not coming to me because they're interested in CBT or REBT. They are not coming for a course. They're coming to me because they want to resolve a problem. And to that extent, I would always prefer using a more integrated approach. Now, with which client what will I use will depend upon where am I getting results. So I generally start with the basics first and then move into deeper processes. So I would generally start working with the client in a way in which I'll just help them understand what steps they need to take through question and answer. If they tell me that they're able to take those steps, I probably would not need to use any of these. But if the client understands what steps they need to take and their thoughts are stopping them from taking action, then I would probably
Hmm.
just go through thought restructuring to check if that alone is enough for the client to be able to take steps naturally, effortlessly, without creating additional conflicts in their life. If they're able to, then my work is done, right? But if the client comes and tells me that I'm not able to, or there are multiple areas where I'm facing the same situation, then I would go to REBT or I would start working with belief, simply because working with thought in each area will be probably too much. But identifying a belief which is leading to multiple thoughts helps me kind of reduce the time frame required to work with the client to a large extent. Well, I'm just reducing the time frame required to create a change. So it whether I'll use REBT or CBT or a combination or something else completely different. It purely depends upon what's happening with the client. And how do you decide that? Is you work. I would go layer up. So go back to the first episode when we spoke about the different layers of the problem. Start working with the most basic layer and then go deeper and deeper to see if you need to go deeper. At whichever level the client says that I'm able to create a change, we are good.
Perfect.
Otherwise, we go deeper.
Perfect. Neha, I hope you have your answer there. Amit is saying OCD, explain it with more examples if possible. I think you have done that.
So, all right.
And
If I have to,
another
so if I have,
another question about
hmm,
OCD. Let me just
hmm,
say it so that you can answer them too. Ranjit is saying, just to add to my previous one, for every obsession of him, I have been doing this only. What would be more effective therapy in addition to this? Bracket may his level of distress has reduced relatively.
correct. So, all right. So to answer, so let me
Ranjit.
answer Amit's question in terms of example, and through
Hmm.
that, probably I'll also be able to answer what Ranjit is asking.
Ranjit. Hmm.
Right. So I'm answering Amit's question, and along with that, I'll answer Ranjit's question also.
Okay.
So I was working with a client who had a compulsion with respect to cleanliness,
Mm-hmm.
right? And the thought in their head repetitively was that things are dirty and I'll fall
Hmm.
sick. So that
Hmm.
particular repetitive thought ensured that they kept, and it had reached an extent where they told me that Nitin, if someone uh, even touches the door, the outside of the door of my house, and then touches the wall, I would clean the wall. So with this particular person, when I started working with them, I began by first asking about the thoughts they have. The thoughts was that I would that it's dirty and it would I will go sick. We tried working with the restructuring. The restructuring which brought the distress level down, but there was still compulsion. And while probably the degree of compulsion was lesser, but there was still problem that the person was facing, and it was big enough for them to continue with the sessions. In the subsequent sessions, I started looking at going deeper into the beliefs, where I don't remember the exact belief that the person had now, but it had something to do with safety, uh, about them being safe, them being unsafe, something on those lines. We worked with that, and we worked with a positive intention. In her case, the positive intention was that it will keep my kids safe. So while she had a problem with her own safety, her bigger positive intention came from the fear that she had about the children's health. Okay. Coincidentally, in her case, the children's health thing happened because in one of the past experiences, she had been careless where something was dirty or something happened because of which there was a mosquito that came and bit the child, and the child went through certain I think some allergy or something, which was like really life threatening. And the doctor had really taken the mother's case that since you know that your child has this allergy, how can you be so careless and so on. So all of
Fearless.
those ideas kind of got stuck in her head. And once we worked with those experiences, so in her case, it was like really layered. We worked with thoughts, we worked with beliefs, we worked with past experiences, and the fear, the positive intention that they had with respect to their kids.
Okay. Right. I hope Ranjit and Amit, you have your answers there. Nitin, another one on OCD. Sita Lakshmi is asking, would only therapy work for an octogenarian with OCD? I presume medication would be required given the age and the person has been having this for so many years and its intensity by now. Added to this, that the family is expecting instant results.
Uh, okay. So here's the thing. If medicines are required, medicines are required. I would never say that not take medicine and only go for therapy because I am not a specialist in medicine. I am not a psychiatrist. I have no right to interfere in their line of work, right? So I would request the client to go to a psychiatrist and or a doctor or whatever the case may be and check if they require medications. And if they require medications, they can continue taking medications. My work with them will be complementary. Now, how would I assess whether my work is working or not? Is that the requirement of their medicine should reduce over a period of time,
Hmm.
right? Which when the client, what should I say? Which when the doctor who has prescribed the medicine is working with the client, they would notice the improvements, and as a result of that, the doctor would eventually bring down the level of medicine. As far as the problem being there for a long time, I have actually noticed the duration with for which a problem has been with the client is not
Hmm.
necessarily connected to how fast you'll be able to help them resolve the problem. I've had
Hmm.
situations where people have had problems for like years and it got resolved in one session. And then there have also been situations where people have had problems like for a couple of weeks, but it took us like 7, 8 weeks to be able to work with that problem completely. So I would not necessarily equate the two together.
Correct. I hope Sita Lakshmi, you have your answer. Deepika is asking, do you have any suggestions for orphan children behavior issues since it is difficult to get one-on-one attention for them?
So Deepika, I have personally not actually worked with an orphan child. So it will be very difficult for me to give you a suggestion because I've never worked with them. So whatever I say would be probably highly hypothetical, right? And probably that's the reason I would suggest that this is a question that you will be better off asking someone who has been working with orphan children. Maybe I can check if I know of certain people who we have trained who also work with orphan children, and then I can get back to you on this answer, on this question.
Perfect. Uh, okay, Sita Lakshmi is saying okay. So those are the questions so far. Nitin, going back to our discussion.
All right. So
Uh,
there are a couple of things that I
yes,
needed to finish about REBT. So let me finish that because we are again like
yes,
1 hour 15 minutes
yes,
now.
yes, yes, please.
So so what all did I speak about? I spoke about beliefs. I spoke about
Irrational beliefs, unconditional acceptance, and secondary disturbances.
and secondary disturbances. Uh, Another thing with REBT is that REBT recognizes that not all negative emotions are bad. That there are certain negative emotions which are helpful,
Mm-hmm.
right?
Okay.
And to that extent, this is very similar to Flip. In fact, to be true, Flip was actually created as a model that was simplified based on the primary REBT understanding.
Okay.
Okay. So
All right.
to that extent, and that's good because otherwise, a lot of people in the field of therapy would claim that certain negative emotions are bad and that all negative emotions are bad. Well, all negative emotions are not bad. Obviously, some of them are serving some purpose. So it's just our inability to understand those emotions and work with them. And that's where REBT differentiates itself with other fields of therapy. And I think that's a very good understanding to keep in mind, even if you're using any other approach to therapy. Right?
Correct.
Now, the
All
difference
right.
between the way REBT would work with this and the way I would work with this would be this. REBT would try to move the client's concerns from anxiety to concern. In the sense
Hmm.
that anxiety becomes like more unhelpful emotion, but if you're concerned
Hmm.
about the same thing, concern is more helpful.
Hmm.
I would look at it in terms of if the client is feeling anxious, and let's take an example that the client is feeling anxious because they are afraid about their future.
Hmm.
They're anxious about the future, right? So
Hmm.
I would first look at work with the client and ask the client, all right, what about the future is causing anxiety for them? It's generally that
Hmm.
the future is uncertain. I would then check,
Hmm.
do they have a plan in place or not? Because if it's uncertain, then probably it will be a good idea for them to have some plan in place. If they don't
Correct.
have a plan in place, then I would first help them work with the plan. Now, once they've created a plan, any which ways their anxiety levels would come down for a simple reason that now they have a
Correct.
plan in place. That said, there are
Hmm.
some people who may have anxieties about the fact that while I have a plan, I can't really control the future. For example, again, we are in a situation where we are in lockdown. We couldn't have planned
Hmm.
for this. So then what happens if things don't happen as per my plan? So one, I would work with the client in a sense that um, I have planned for the future, that
Hmm.
I would also work with faith as per my plan. I would also
Hmm.
work with the client with respect to the confidence that if things don't happen as per my plan, I will find a way to be able to find something good out of it. And while all of
Correct.
this is done, acceptance will still be incorporated in the process that while we are taking care of everything, there are things which I will not be able to control. And I just need to
Hmm.
learn to be at ease with that. It's basically, so there's this sentence. So there's a book that we've just published recently, which is Destiny of Choice. And in that book, I'm it's again based on a question and answer like I and Mamta are having with another student of mine that I was having a conversation with. And in that, there's one sentence that I've spoken, which is that as humans, we can never know everything. And the sooner we understand it, the better it is. And that understanding and that acceptance is what is going to be imbibed in the client as a part of the therapy. So, what we are doing is we are not just moving the client from anxiety to concern, we are also helping
Hmm.
them develop faith, hope, confidence, and acceptance to take care of the
Oh,
entire thing more holistically.
perfect. That's like a very near perfect model. Great. Nitin, we have been speaking about irrational beliefs repeatedly. We lost Nitin again. Okay, so I'm sure he'll join us soon.
This happens many times.
That's okay. We'll
Sure,
never
sure.
know everything
Yeah, we
that's
never
to
know
come.
everything.
Perfect. Okay. So, Nitin, I was saying that we've been repeatedly talking about irrational beliefs. So, while you have said that we may do an episode at the end of the series when we'll talk about thinking styles and irrational beliefs, can we quickly, like, is, is there a summary? Can you sum them up? What are these irrational beliefs?
Right. So there are like 11 irrational beliefs, and these
Okay.
11 irrational beliefs generally revolve around three big, what we call as musts,
Musts.
right? Correct.
Okay.
So
Hmm.
okay. So the three musts are, one is
Hmm.
I must do well and win others'
Hmm.
approval, or else
Hmm.
I'm no good.
Okay.
Second is others must treat me fairly and kindly, and in a way in which I want them to treat me. If they don't
Okay.
treat me this way, they are not good enough and they deserve to be punished.
Mm-hmm.
And the third is I must always get what I want when I want it.
Okay.
If I don't get what I want, then I'm miserable.
Mm-hmm.
And these
Oh.
three big musts are then further divided into 11 irrational beliefs,
Hmm.
which, as I mentioned, we'll probably take it up in a separate episode altogether.
Okay. Perfect. Perfect. So Nitin, again, there are some questions. Uh,
Please,
लक्ष्मण इज आस्किंग अगर किसी पर्सन को बहुत ज्यादा ड्रीम्स आते हैं और इसके वजह से एक्सेसिव एंजाइटी हो रही हो तो इसे इस कंडीशन में क्या बेहतर होगा
so with dreams, I have a very simple process to work with, and I generally have noticed it works for. I think it's worked for everyone that I've ever worked with, including myself. If you are
हम्म
someone who gets a lot of dreams
हम्म
that are bothering you, before sleeping, just give a suggestion to yourself saying that I understand my mind is processing a lot of information while I'm sleeping and they
हम्म
are being converted into dreams. While I'm okay having those dreams, when I wake up in the morning, I would rather prefer not to remember the dreams. So that when I wake up fresh, feeling wide awake. And that generally helps. Matlab, if you do it for 4 5 days as suggestions, that generally ensures that you stop having or stop recalling the dreams when you wake up in the morning. But in case if the dreams are like nightmares and they are repetitive nightmares, then they may also be trying to convey a message to you, because dreams many a times are a way in which unconscious um, communicates with you. And that's the place where working with dreams may be important. We will talk about it more tomorrow now when we talk about psychoanalysis and things related to that, because dream interpretation becomes a part of that.
Perfect. I hope, Lakshman, that answers your question. Amit is asking, which are these negative emotions that are good? I think when we were talking about flip, is that when he asked this question?
Correct. So, Amit, from a very simplistic point of view, concern is a negative emotion, right? That you're concerned about something, but it may not necessarily be unhelpful. It may be helpful because it helps you prepare better. There are also certain people who will say that when we feel a bit of stress before papers, we study harder. So that some amount of stress is also helping them perform better, right? So it's not completely unhelpful. It's helpful to some extent. When we spoke about flip, just a second, sorry for that. So when we spoke about flip, in flip, like we spoke about guilt and we spoke about helplessness, so we spoke about worry. The idea is, if you understand what is causing them,
Mm-hmm. Yes.
right, then then there is a way of working around it. So, and if you've not watched a movie, there is a movie called Inside Out. Mamta, do you remember the name of the movie?
Yes.
The childhood
Inside,
movie.
inside, inside out.
Inside Out, right? So, I mean, that's a
Yes, yes.
very good movie where they've actually shown how sadness, which is considered to be such a negative emotion, can actually be one of the most important emotions that we experience in our life.
It's an animated children's movie, so you'll probably find it or on Amazon Prime or Netflix. I'm sure it's there somewhere. Okay, Sita Lakshmi is saying, slow it down, please. Could you repeat that suggestion? I think she's talking about the self suggestion for dreams, for recalling the meaning of the dream or stopping the dreams.
Correct. So, the suggestion for stopping the dreams would be that before you sleep, you tell yourself, while I understand that my mind has been showing me certain dreams, because maybe it's processing information and it's trying to bring something to my notice, I would rather prefer that my mind processes the information, but I am not aware of these dreams. So that when I wake up in the morning, I wake up feeling fresh and wide awake. Now, this is just one example. Basically, it's a suggestion that you're giving to yourself, telling the mind that do whatever you want to do, but please ensure that I don't remember the dream when I wake up in the morning. Okay, and I wake up feeling fresh and wide awake.
Perfect. Perfect. She's saying yes. Lakshman is saying yes. Thank you, everyone. Nitin, it's 11:23 once again, and I want to ask you about DBT. So, what do I do?
So we can quickly talk about DBT and get it done with, because DBT should not take much of a time.
Okay. So, my question is I've heard about DBT, which is also known as dialectical behavioral therapy. So, what is that? And what is the difference, and how do we use it?
So DBT is again a variation of cognitive therapy. It's like an application of cognitive therapy. In addition to what CBT talks about, DBT will
Hmm.
also put a lot of emphasis on mindfulness. And
Hmm.
in DBT, mindfulness is probably the most important strategy. The
Okay.
idea is to teach people to be in the present and focus on what is happening in the now,
Hmm.
which enables the client to observe what's happening inside them as well as what's happening outside them in a non judgmental way.
Okay.
And then mindfulness obviously has its own advantages. It helps you slow
Hmm.
down, it helps you stay calm, it helps you
Hmm.
ensure that you avoid engaging in negative automatic thought patterns and impulsive behavior.
Okay. All right. All right. Uh, and since you've already shared with us that mindfulness can help us get into a receptive hypnotic state, that means it can be combined with DBT really effectively, right?
So mindfulness is actually one of those things which is like relaxation. It can be both a route to induce a hypnotic state, and it can
Hmm.
also be an effect that you can create in hypnotic state. Which means that if you have
Ah.
a client who is naturally having a tendency to focus on things effectively, then you can use that focus, that mindfulness, to be able to induce them into a receptive state. But if a
Perfect.
client is too distracted and is not able to become mindful, is not able to kind of imbibe that mindfulness as a part of their
Hmm.
behavior, then you can
Hmm.
use another processes to induce them in a hypnotic state first, and then in a
Hmm.
receptive state, teach them to become more mindful. So you can use both
Okay.
mindfulness and relaxation as a cause or as a route to
Hmm.
hypnosis, and as an effect that you can create in hypnosis.
Perfect. All right. And apart from mindfulness, is there something else there in DBT, or that's it?
So apart from mindfulness in DBT, there's also a lot of emphasis on distress tolerance, where
Okay.
the idea is to be able to learn to tolerate any distress that people are experiencing. And
Okay.
there will be certain strategies that they will be taught based on which they'll be able to tolerate this distress better. And these
Okay.
strategies will include self-soothing, distraction, thinking of the pros and cons of not being able to tolerate the distress effectively, and finally
Okay.
improving the moment.
Okay.
Now, while
Okay.
distress tolerance is a useful concept,
Mm-hmm.
um, it can take some time to be able to develop that distress tolerance,
Exactly.
uh,
Yes.
especially using the process that I've told you right now. And
Mm-hmm.
many times the distress levels are so high that it is the
Hmm.
distress levels that stop us from being able to practice the techniques that will help us increase our tolerance to distress levels.
Yes. Correct. True.
It's kind of chicken and egg story at times.
Hmm.
And that's when probably other processes. So again, for me, I would go back to hypnosis right now, receptive state, but I would probably use another process to first get them into a more relaxed state, then use suggestions to be able to help them practice each of these strategies in a receptive state, so that they're able to imbibe them and able to use them as a part of their day-to-day life, and also the part of their resolving the problem that they have.
Perfect.
Right? And
Okay.
lastly, before we
Hmm.
end, the last thing in DBT is sorry, the second last thing in DBT is personal effectiveness, or
Hmm.
interpersonal effectiveness, where we are also focusing on helping people develop the right skills, like assertiveness, like communication, like conflict management. So there's a lot of emphasis on skill management also,
Mm-hmm.
right?
Okay.
And this combination of helping people being able to get into the right emotional state, and also being able to develop the skills and apply the skills rightly,
Mm-hmm.
would lead to obviously interpersonal effectiveness, and also would lead to a lot of positive improvements in different areas of their life.
All right. Perfect.
And last, the DBT also focuses on emotional regulation. We are able to identify, name, and change your emotions.
All right, perfect. Nitin, with whatever we have discussed today, I'm sure with hypnosis we can do the last points that you just mentioned: emotional regulation, help clients change their emotional states quickly, and develop skills, get into a mental state that they can develop skills more effortlessly. So I think all that can be achieved, right, with the help of
So,
hypnosis.
correct. So, Mamta, the thing is, as I said, hypnosis is a receptive state. You could combine it with anything and everything. So, you would probably be able to do everything with hypnosis if you know how to use it correctly. That's basically the caveat that is very important. It's not just
Perfect.
about hypnosis, it's about your skill in terms of how you're using it.
Right, and that is why we've been saying repeatedly that it's like a thread that runs through, or can bring all the approaches together, right?
Correct. Correct.
Okay, Nitin, there is two questions. Jaswinder is asking, is hypnosis just suggestions? I would like to answer this. Jaswinder,
Done.
we have talked about hypnosis in great detail. I would recommend that you watch episodes, Nitin, 3 and 4,
Three
or
and four.
2 and 3, 3 and 4.
3 and 4.
They are there on the IHR's Facebook page as well as our YouTube channel, and the links are there in the group as well. So we have discussed, I think, everything that's there to be discussed, and that it would be great because it has been done in great detail there, right, Nitin? Am I right?
Yeah, it has been. And also, if any of you are interested, on the ICHA's website, there is currently a free foundation course which is available on the eclectic
Yes.
approach therapy titled Cognitive Hypnotic Psychotherapy. Maybe if you want, you can go through that program also. It's available for free right now. But the idea is that that gives you a lot of understanding about even what hypnosis is, probably in more details than what we have covered uh, in the question and answer.
Perfect. So, foundation course in cognitive hypnotic psychotherapy, right, Nitin? The
Correct. So
website
I'll
is
just share the link. I'll just
www.
share the link.
Okay, perfect. That would be great. One question is there. Sita Lakshmi is asking, how would life skill development differ from DBT?
So life
Thank
skill
you. We got
development
that.
would be a part of DBT. Matlab, when you are talking about personal
So,
effectiveness is one component of DBT. DBT emphasizes also on other things, for example, that we spoke about in terms of mindfulness and in terms of distress tolerance and so on.
and
So
emotional
to that extent,
regulation.
and emotional regulation. So life skill development would be a part of DBT. But nowadays, a lot of these terms are being used so interchangeably that the meanings are getting blurred. So it's also true that what I'm saying is more in terms of like strictly speaking definitions, but its
Hmm.
applications in life are changing. I know so many life skill development program which focus on emotional regulation. They also focus on being able to identify, name, change the emotions. Emotional intelligence is a good example of a program which focuses on that. So if you combine emotional intelligence with mindfulness and certain skill development processes, that probably can be called both DBT and can also be called life skill development. So it
Correct.
just depends on how you're using the terminology. I hope that answers your question.
Yes, I hope so. I don't see any other questions. Uh, so I think that brings us to the end of this episode on the twin episodes on cognitive approach and related therapies, how it can be integrated with hypnosis and behavioral therapy. So I think it's time to call it a session.
Perfect. So thank you everyone for being there, for asking all the questions that you have asked. If you have any questions, please feel free to ask us again tomorrow and we will answer them. Tomorrow we are going to focus on psychoanalysis and psychodynamics and how it can be incorporated with the cognitive approaches and the behavioral approaches that we have spoken about. And how by itself psychoanalysis is important and why you should know about it. So, thank
Perfect.
you.
Nitin, just
Good night.
before we say bye-bye,
Mhm.
you mentioned the book Destiny of Choice. It would be a great
Mhm.
help if you can share the link for that as well. So people who
It's
are interested to
destiny
go and have a
of choice dot page
okay.
is the link.
Destiny of Choice dot page.
Correct.
Okay, perfect. Oh yes, we got it. Thank you so much. Thank you everyone
So
who
I think
tuned in
it will
today.
not come as a hyperlink. So I'll just write it
It
again.
hasn't. Thank you so
Right.
much.
I'll just edit it and write it again.
Yes, Prashanti is also saying, can you share that link? Bhavani is saying, can you suggest a course on mindfulness?
Can I suggest a course on mindfulness? There is someone that I know of who conducts a course in who is very good with mindfulness. Let me check if he actually does a program on mindfulness. If you're only looking at mindfulness, then that's probably what I would check and I would suggest to you. Probably give me till tomorrow and I'll suggest it to you. But if you're looking for like a more comprehensive eclectic approach, which includes mindfulness, then the CHP program would be better because we already incorporate a lot of elements of mindfulness in it.
Okay, Sita Lakshmi says, thank you. Thank you, everyone. It's time we say goodnight. So, signing off now. The links are there, all the links that we talked about, and we'll see you tomorrow, same time, 10 p.m. at FP Live. Thank you, Nitin. Good night.
Thank you. Take care. Bye bye. Good night.